Surgery for facial trauma can involve many bones of the face and frontal sinus. Maxillofacial injuries can involve skin, muscles, nerves, blood vessels, and teeth. There are also psychological effects that must be taken into consideration because of the concerns of disfigurement of the face. The design of the midface is not only to protect the orbits and the cranium, but also to resist vertical force. Plates and screws are commonly used to fix fractures of the bone or the face in the frontal sinuses. Power drills are needed to place the screws. Any drill that has entered the patient may not be re-sterilized and reused. It is supposed to be disposed of. The skin prep for the facial fracture usually is betadine, and the entire face is prepped from hairline to sternal notch, with the endotracheal tube included in the prep, and prep last. General anesthesia can be given through the nasal RAE tube because of the surgical site and damage to the oral area. Often the eyes are lubricated before the prep begins to protect the corneas. A throat pack in which a Raytec is placed in the throat after the patient is under anesthesia is often used. The packing must be charted and must be counted with the sponge count. Do not forget about the throat pack. Arch bars are applied to realign the teeth or to maintain the patient's normal bite. This is often referred to as wiring the mouth shut. In a case of emergency, wire cutters must be sent with the patient to PACU and to his and her room. ORIF, or open reduction internal rotation, is performed to correct fractures of the midface. These fractures are classified as Lefort fractures 1, 2, and 3. The Lefort 1 is a horizontal fracture of the maxilla that causes the hard palate and the alveolar process to become separated from the rest of the maxilla. A Lefort 2 is a pyramid fracture also associated with the leakage of cerebrospinal fluid into the nasal sinuses. And the Lefort 3 is a separation of all facial bones from their cranial base with severe facial flattening and swelling. To reduce a zygomatic fracture, a 2 to 3 centimeter incision is made below and parallel to the lash line following a natural crease, and the fracture is reduced or repaired with bone grafts and or metal or plastic implants. Orbital fractures are associated with the traumatic events and are often called blowout fractures. Orbital contact herniates into the maxillary sinuses, and the inferior rectus or inferior oblique muscles may become incarcerated at the fracture site. The mandible is the only movable bone of the face. The goal of surgery is to restore the patient's dental occlusion to what it looked like before the injury. Dental implants are used to replace injured or lost teeth. They may replace a single tooth or multiple teeth. Endosteal implants, a threaded screw implanted into the alveolus of the maxilla or mandible, then covered with soft tissue. Subperiosteal implants is placed beneath the periosteum directly on the alveolar bone, used when the bone is insufficient to support an endosteal implant. Transosteal implants are bone plates with retaining posts. Mandibular and maxillary advancements are done to correct a bony deformity. These procedures can be done to help align the teeth, correct the patient's bite, and to improve appearance. TMJ arthroplasty is done to reduce pain and increase mobility of the joint. Many oral surgeons bring their own scrub person with them to assist during the case, so you might not get the opportunity to first scrub many of these procedures.